Hi, I'm Dr. Camilla Cameron. I'm a doctor of traditional Chinese medicine, a Japanese acupuncturist for the last 23 years, and a vagus nerve stimulation clinician for the last 6 years. I've conducted over 35,000 acupuncture treatments and over 6,000 vagus nerve stimulation treatments also. I also sell vagus nerve stimulation online on my website, and today I'd really love to talk to you about what a normal period looks like. So, 51% of the population is going to spend nearly half their life menstruating. And it really surprises me every time people come into me and aren't really sure of what their period should look like. And I guess that's because we haven't really spoken about periods a lot. It's really in the last decade that I've noticed people are comfortable talking about their periods. People are happy to talk about the fact they get their periods and acknowledge it. So today I'd really like to talk about what you should expect is a normal period. And anything outside of that realm is probably not normal and what we can do about it. I kind of love talking about periods. I find them really interesting. I feel like they're an awesome gateway into understanding someone's health. And it gives me a really good idea of what I need to treat as well when I understand someone's period better. So I know that sounds really weird, but that's just how I am. And I give you a bit of a background into my history with my personal menstrual cycles and probably give you some idea of why I find periods so fascinating. So my first period, I was 12, and which, that's a pretty normal time to get your period. And it was kind of exciting at first, and then it kind of seemed to never stop. And I got to 10 days, and I remember saying to my mum, this seems like a really long period. And then I got to 15 days, then I got to 20 days, and this is well and truly before the internet. So the best I could do was go to doctor's offices and find pamphlets, and they're saying to me maximum 8 days, and I'm at 20 days, and I'm thinking, well, this is not right. Then by the time I got to 60 days, my mum finally agreed to take me to a GP because obviously 60 days is way too long. And I remember the GP gave me a tablet, which I can only assume was a high dose estrogen pill for 7 days. And then she said, this will stop it. Then you'll get your period again. And however long your period is after that, that's the length of your period for the rest of your life. And my period after that was 10 days. And I thought, oh, well, that's certainly better than 60. And true to her word, my periods were pretty much 10 days until I worked out how to actually look after my hormonal health better. And that introduction to my period probably set me up to believe that periods are always going to kind of be bad. I think I had this really low expectation of periods from that point forward. So, from about 12 to 17, my periods were really irregular. I had no idea when they were going to come, which sometimes is normal. Sometimes girls listening to this who are not 17 yet, it's normal to have irregular periods up until a point, and that's nothing to worry about. Then I got to 17 and I went on the pill for about 6 years, I think. And so that regulated my periods, but they were always still really painful, very, very light comparatively, but really, really painful. Again, I thought that was normal. Then I went off the pill and my periods became incredibly erratic. I was having up to 100-day cycles. So 100 days between bleeding. And then my period would maybe be 7, 8 days, but really, really painful, super heavy, really life altering, not fun at all. But because they were so bad, I thought, well, it's better to have this 100 days in between my cycles because that way I only have these terrible periods every 100 days. Little did I know having the 100-day cycle was partially why I was having such terrible periods. And then, I'm an acupuncturist by this point. I'm treating people for period problems. I'm treating people for hormonal problems. And not once have I thought in there, this is probably not normal what's happening to me, because I think I'd been set up to think from such an early age that my periods were just always going to be bad. And then I tried to get pregnant. So when I'm trying to get pregnant at about the age of 29, I'm treating people for fertility quite a lot. And I'm thinking, this isn't boding well, these 100-day cycles for getting pregnant easily. And I was right. So I think I spent about 6 months just kind of, if I get pregnant, I get pregnant. That's great. And then I started doing a bit more thinking, well, if someone came to me who was me and I had these 100-day cycles and these terrible periods, I probably think, wow, there's lots to change here before this person's getting pregnant. So I started to treat myself like I would treat a patient. And I thought, okay, it's time. I need to do blood tests. I need to have scans done. I need to work out what's going on with my body as to why I'm having these definitely not normal 100-day cycles. And through these blood tests and ultrasound, I discovered that I had really significant PCOS. So I don't know, I think I had 25 follicles on each ovary, and I think they stopped counting. And my estrogen was absolutely through the roof. It was over 1,000, which is crazy high. My progesterone was like 0. So clearly I wasn't ovulating. I had other symptoms of PCOS. So I was a prime candidate for PCOS. I also had an enormous fibroid, a 9 centimeter fibroid, which, that's massive. It's kind of the size of a big grapefruit. And I thought, wow, this is going to be hard to get pregnant. This is not great. And from there, that's when I really started to take more control and get more understanding of my personal hormonal health, because without that, there was no way a baby was coming along, because I quite simply wasn't ovulating. So without ovulation, you cannot get pregnant, obviously. Long story short, on my pregnancy journey, about 2 years later, I did fall pregnant. It took a lot of work. It took a lot of changes. It took a lot of understanding that really gave me massive in-depth understanding into fertility, and so on so many different angles, not just an acupuncture perspective. But that's really for another video. Today is about what is a normal period, and clearly mine were definitely not. So let's start with cycle length. I find a lot of people don't actually know what I mean when I say, what's the length of your cycle? So the length of your cycle, the first day of your period is day 1. The next first day of your next period is day 1 of that period. So your first day of your bleed is the first day of your cycle, and then you continue on until the next first day of your bleed, and that's the end of that cycle. The length of your cycle should be between 28 and 35 days. You can probably get 26 to 35 days. That's probably acceptable. I find people sometimes get a little bit obsessed. Like they're like, oh, my last cycle was 27 days, but this one's 29. That's okay. Not many people fit a perfect textbook of a 28-day cycle. And if you do, that's really lucky, because it's so much more predictable and you're probably incredibly fertile. You've probably got great ovulation happening. But yeah, so generally speaking, I would say a normal length of a cycle can be anywhere between 26 and 35 days long. So then how long is your period? And that's the two I feel like people get confused, is cycle length and period length. So obviously your period length is the length of time you're bleeding for. And I generally count day 1 as a proper bleed, not spotting in the lead up. So yeah, day 1's when you're actually bleeding. And I would say anywhere from 3 days, lucky you if you're getting 3 days, to 7 at a push is normal. Anything beyond that is too long. And anything shorter than 3 days, I'd say you're probably not bleeding enough and possibly not ovulating and not building up a thick enough lining. In saying that, there are different variations on normal, and some people just are really lucky to have short periods and they still get pregnant, no problems whatsoever. Now we're talking about the period, so let's talk about the blood. Generally speaking, I like the blood to be between dark red and maybe almost bright red. Anything that's really dark. And look, in the beginning, sometimes, that first day can be darker than normal and then it lightens up a little bit. But if you're getting a dark period for your whole period, or it's like super dark, I have people say, oh no, my blood's black. That's not normal. So that means there's really strong levels of stagnation happening there, and there's quite a lot of old blood, and that stagnation really needs to be moved. So essentially, good colored period ranges from a dark red to a brightish red. The blood should also flow easily. And when I say that, what I mean is, if you're getting spotting for 3 days before your period, that's not an easy flow. That's a struggle flow. And that can be a red flag for endometriosis. I find spotting before your period or spotting after your period, like not having a really good defined beginning and end. I often think, well, there's one red flag for endo. And then if there's lots and lots of clotting, so we don't ideally want any clotting. A perfect period has no clotting. I wouldn't describe clotting as ever being normal. That's not to say, when I say normal, so many women are not normal in their periods. I'm not saying there's anything necessarily wrong with you, but what I'm saying is these are not ideal periods. So an ideal period has no clotting. The bigger the clot, the more stagnation there is, the more chance there's some hormonal imbalances. I find particularly large clots are often associated with an ovulatory cycle, which is a cycle that didn't have ovulation in it. So in an ideal world, your period flows easily. It's kind of starts when you notice it's starting, and then it really starts, and there's no clotting associated with the bleeding. Now, the next thing I'd like to talk about is pain. So period pain. Now, I've had male practitioners I've worked with say you should get no pain at all with a period. I think that would be awesome. And I know there are some women who really, really don't get any pain with a period, but I don't think that's very common. I consider normal period pain maybe a couple of hours when you first get your period. So in the beginning, you're really contracting that uterus to get the blood out. And so that's kind of uncomfortable. So if you're getting a couple of hours, maybe just before you bleed or when you start bleeding, I'm going with that's okay. Anything beyond that, I'm going with that's not okay and not ideal. So let's go back a little bit. If you're getting period pain days before your period, I'm ticking red flag for endo. Period pain before your period is definitely not a normal thing. So some women know they're getting their period because they kind of feel a little bit twinging and there's just a different sensation down there. That's different. That's being in tune with your body. I'm talking pain that's really uncomfortable. That's, yeah, tick and endo potentially. Then once you're getting a period pain during your period, again, that's not ideal either. Another red flag for endo is back pain associated with your period. And the other really big one is a dragging sensation or pain down your legs. And this can actually be due to lesions or endometriosis lesions on or near nerves that run down the legs from the pelvis. So, yeah, definitely if you're getting spotting before your period, spotting after your period, pain before your period, pain in your lower back, pain down your legs, you're ticking quite a few endometriosis red flag boxes. Another measure of a normal or ideal period is how much blood loss is occurring during the period. And this is such a subjective measurement, isn't it? Because we've only ever had our own periods. So someone's light period is another woman's heavy period. So the best way to judge whether you're having significant to too much blood loss is really to get a gauge on how many menstrual products you're using in one period. So normal blood loss during a period is considered 10 to 35 mils. So 35 mils being the upward range of normal. A regular pad or tampon will hold about 5 mils. So we're talking 7 of those filled is your kind of maximum for normal. Anything beyond that is considered too heavy a period and heavy blood loss. So there are many reasons why you may be experiencing heavy blood loss, but the number one, absolute number one I find in clinic is low iron levels. So having your iron levels tested when you have heavy blood loss is imperative because unfortunately, and I don't know when we were made why they decided this was going to work the way it does, when you have low iron, your periods get heavier and then your iron gets lower. Crazy, right? Another reason you may be experiencing heavy blood loss is because of estrogen dominance and progesterone deficiency. These two do tend to go hand in hand. Often these occur because you aren't ovulating, so you're having cycles without ovulation, which means you don't produce enough progesterone, which in turn increases your estrogen, and then the ratio is out of whack as well. So you then end up in estrogen dominance. You can, of course, have estrogen dominance, progesterone deficiency, and an iron deficiency. In fact, all of the things I'm going to mention that could cause heavy blood loss, you could have all of them. Fibroids are often a cause of heavy periods. They're a really common cause of heavy periods, actually. In particular, we find fibroids in perimenopausal years quite common, and that is because more and more cycles in the perimenopausal years are actually lacking ovulation. So, the older we get, the less we tend to ovulate, therefore, the less we produce progesterone, which means fibroids have a perfect environment to grow within because we can become quite estrogen dominant, and estrogen dominance is great for fibroid growth, unfortunately. You can also get fibroids like I did in your 20s. That's totally possible, but it is much more common in women as they get closer to menopause. And other things that can cause heavy periods is PCOS. Again, because of the lack of ovulation, we're having that estrogen dominance, and that can then cause heavy periods. And then a really rare one is you could possibly have an STI. The one that people don't tend to complain about anywhere near as much are light periods, because who doesn't want a light period? But if you're getting light periods and trying to get pregnant, they can sometimes be an issue because essentially, if your period is really light, it often means your uterine lining is not thick enough, which makes it much harder for the embryo to implant and therefore maintain a pregnancy. So, if you're having light periods, sometimes I would say almost rarely you're iron deficient. Another one is endometriosis, and I'd say actually this is more common. I do find women who come to me with really light periods and other endometriosis signs. That is a tick, a red flag tick for endometriosis for me if you're having significantly light periods. There's also various hormonal imbalances that can cause light periods. And the other really big one is perimenopause. The closer we get to menopause, for some women, the lighter their periods become. And then obviously they tend to get more irregular as well. And that is quite normal and common. So, in summary, your cycle length should be between 26 and 35 days in an ideal cycle. An ideal period length is between 3 and 7 days. The amount you should bleed during this period should take up no more than 7 regular pads or tampons fully filled. Anything more than this is far too much. Anything less than, let's say, 3 full regular tampons or regular pads is too little a bleed. In terms of pain, you ideally would experience no pain. Acceptable pain levels would be between the kind of the beginning of your period, just before the beginning of your period, and maybe 2 hours into your period, a little bit of mild cramping. That's acceptable pain levels. We also don't want ideally any clots in our period, and the larger the clots, the more the stagnation is, which indicates more situations that are less ideal during your cycle that may be causing these clots. So, why might your cycle or your period be dysfunctional? And there are so many reasons this could be occurring. And often I find it's not one reason, it's several. It's rare I find that people come in and I go, okay, it's this that's causing the problem. It's usually this, and this that's causing the problem. Now, the various things that can cause a problem from a medical perspective are things like iron deficiency or anemia, endometriosis, various hormonal imbalances. We also have PCOS, fibroids, and lots of other gynecological conditions that we could attribute to why your cycle length or your periods are not ideal. So, I've spoken about the negatives, so the dysfunctions of cycles and periods. And what I really want to point out while we've gotten to nearly the end of this video is that your cycle and your periods are changeable. What you have right now does not have to remain the same. We can make changes to diet, lifestyle, add acupuncture into your life, add vagus nerve stimulation into your life, get pathology tests done, have ultrasounds done, get a whole picture of what is going on and why your cycle and period are the way they are. It is really important to note as well that cycles and periods are awesome education into your health and where particularly lifestyle factors may be affecting your health in general. When you engage our services at Happy Healthy Clinic to help regulate your cycles and periods, we utilise a 7-step process that is not available at any other clinic within the world. The first step of our process, which is particularly unique, is vagus nerve stimulation. We then combine this with our second step of the process, which is Japanese acupuncture, which is gentle yet effective acupuncture. The third step is we utilize dietary advice. The fourth step is lifestyle advice, which is super important. There are so many things lifestyle wise that often need changing when your cycle or period is out of alignment. The fifth is individually tailored supplements if you require these. The sixth is education. We really believe in educating our clients so that you can be more in charge of your medical destiny, so that you can understand and empower yourself as to why your situation was not ideal when you came to us and how to maintain an ideal period and cycle from that point forward. And the seventh step is we can engage and refer you for pathology or for scans if this is necessary. If you come to us for fertility, for example, we also add an eighth step to this process, and that is analysing your basal body temperature chart and educating you to understand how this affects your cycle and how these hormonal changes are showing up in your basal body temperature. Thank you so much for watching my video on what is a normal period. I hope you gained some information from this and you feel more educated on what a normal period should look like. And hopefully you got to the end. It was pretty heavy going there. And I just want you to read my disclaimer, which basically tells you that this is an educational video and is not meant for medical purposes and certainly does not replace any medical advice you may get from a medical practitioner. If you did like my video, please subscribe. This way you'll be able to receive more information that I'm putting out there about the combination of Western and Eastern understandings in health. This way we can get a more overall holistic approach to maintaining our health and gaining better health. Thanks very much.